Hello, my name is Kimberly. I'm going to be demonstrating female indwelling catheter. Alright, so first I'm going to start by checking my provider orders. So I have an order for a Foley catheter for Charlene Knight. Her allergies are latex, penicillin, and betadine. So I'm going to go into the room and I'm going to confirm this with her. Alright, actually, before I go into the room, I'm just going to perform hand hygiene too. Alright, so knock, knock, knock. Hello, my name is Kimberly. I'm going to be your student nurse. Can I see your armband for you? Alright. Can you say your first and last name and your date of birth? Charlene Knight, 8/8/1939. Alright. Can you let me know your allergies? Latex, penicillin, and betadine. Alright. So that matches my orders, so that confirms that she's the right patient. Alright, Mrs. Knight, I have an order here for a Foley catheter. I see you haven't urinated in 10 hours, is this correct? She'll confirm this. Alright, so I'm going to go get some gloves and I'm going to check your perineal area, okay? I'll be right back. So I'll put this here. Perform hand hygiene. Okay. I'm going to don some gloves. I'm going to check your perineal area now, okay? Right. So now I'm going to check. I'm looking for any redness, swelling, discharge, anything that would contraindicate the insertion of a Foley catheter. I'm going to visualize the urinary meatus. And then at this point, I would do perineal care if it is necessary. Alright, and then I'm going to palpate the bladder. It's distended. Alright, Mrs. Knight, I'm going to go get my sterile equipment, okay? I'll be right back. Alright? I'm going to take off my gloves. Perform hand hygiene. Alright. Set this aside. Now I'm going to inspect my kit. Alright? So I'm going to inspect for any breaks that may cause it to be unsterile. So this one's sealed. Alright, I'm going to check the contents. So it's a Foley catheter 14 French. So that matches my order, so that's good. I'm going to check the products. This one has latex, and usually we wouldn't do this because she's allergic to latex, but we're going to pretend that it's not. Alright, and then I'm also going to check the expiration date. So 4/2017, so we're good. Alright, so I'm going to lay this on a clean, dry surface. I'm going to open the bag actually first. Lay it on a clean, dry surface. Alright. Actually, it doesn't have to be clean, but I'm going to be using this as my trash bag at the end of the bed. I'm also going to put her in dorsal recumbent position now. The only problem I thought I might have is that I touched my hair, but it was already dirty anyway. Now I'm going to perform hand hygiene right before. Touch my kit again. Alright, so I'm going to reposition. Alright. I'm going to start with the first flap, furthest away from me. Then I'm going to open the left flap, touching only the 1-inch borders. Only the 1-inch borders. And I'm going to open the right flap. I'm going to move this a little bit further from the bed, just to be safe. I'm going to open the last flap, touching only the 1-inch borders. Alright. So I'm going to reposition this so it doesn't touch my clothing. Also going to pull it over here a little bit more, so I can put my gloves on. Only touching the 1-inch borders again. This is not sterile. Alright, now I'm going to pick up my drape. Alright. Usually it would be folded, like so. So I'm going to pick up by this corner. Step back, shiny side facing me. Alright. Now I'm going to put the drape without touching her legs. Alright. Alright. Now I'm going to pull it towards her. Alright. Come back to my package. Going to pick up my sterile gloves. Alright, I'm going to pop them here. And I'm going to put them on. Alright. Not turning my back to my field. Alright. Have to be careful how I open this, because it is sterile on the inside. Alright. Open this up carefully. Straighten this out. Being careful. Now I'm going to inspect my gloves for any indications that it may not be sterile. So they look good to me. Alright, and I'm going to identify this is the right glove and then this is the left glove. Because I'm left-handed, I'm going to put my left glove first. Alright, I'm going to touch the inside. I'm not touching anything that's sterile. Okay, I'm going to step back. Only touching the cuff. Letting go. Now for this one, I'm going to put my forefingers inside and keep my thumb out. Step back. I'm going to let go. I got to readjust this hand, but now that I'm sterile, it's okay to touch sterile to sterile. Being careful not to touch anything that's may make me unsterile. So I'm gonna touch the top. Alright? My hands like interlock them, keep them above my waist. I'm gonna move over here. Alright. So now I'm going to pick up my fenestrated drape, step back, walk around the drape, and I'm still only touching the 1-inch borders, even though I am sterile. Alright. Open that up. Oh yeah. Now place it on my patient. Alright. Now I'm going to reposition my box. Open my hydrogen peroxide. To wet my cotton balls. Alright. And I'm going to open my loop. And I'm going to place it, let's see, I'm going to take out this specimen I don't need, place it away from my sterile field. And I'm going to put it in this closed corner tube. Right. Throw that away, keeping my hand above my waist. Alright. Now I'm going to unsheath the catheter very carefully, making sure that I remain in control. Alright. I'll drop the sheet. Alright, now I'm going to lubricate. Leave it there. Alright. Alright, so I'm going to take my sterile water. Alright, uncap it. Alright, pull back. Push back. Alright. Now I'm going to connect it. Manufacturer says that it should be 5 to 10 milliliters, which is what I have here. I'm going to connect it. And at this time, I would check the balloon, but if the manufacturer recommended. But in this case, it is not recommended, so I will not be doing that at this time. Alright, so at this time, I'm ready to go to the bedside. Alright. I'm going to tap it down like that. Alright. Now I'm going to commit this hand to opening, and so that this will be sterile, unsterile. leave it there. Now I'm going to perform cranial care. Alright? So I'm going to go the outer labia from clitoris to anus. Closest to me, from clitoris to anus. The center directly over the urinary meatus, from clitoris to anus. Farthest away from you. And then the center one once more. Alright, now I'm done with this. I'm just going to place it on the side like that. Alright, now I'm going to tell Miss Knight to bear down. I'm going to be inserting the catheter now, alright? Keeping my fingers 2 to 4 inches away. I want to put it in without touching the labial folds. I want to insert it without touching the labia. That would make my hand unsterile. Alright, so as soon as I visualize urine, which I do, I'm going to insert an inch further. Alright. Now with my non-sterile hand, I'm going to stabilize the catheter so I can inflate the balloon. Alright. Alright. Now I'm going to gently tug, make sure the balloon is inflated in the bladder. Alright. So it is. So now I can disconnect because my sterile technique is now finished. I would secure this at the bifurcation with an adhesive, not tape. I would take this bag and I would bring it around the side of the bed. I would not secure it on the bed rails. And then I would document the procedure. I would document how she tolerated it, the input and the outtake, or the input, outtake. Also do catheter care as necessary, and so I'm good.